For nearly 30 years, Palomar Health has served the needs of gravely injured people in northern San Diego County. And in fact, Palomar Medical Center Escondido was honored with the prestigious Lantern Award for its excellence and innovation in emergency care. And that's an honor earned by only 1% of emergency departments across the country. And joining us to talk about how Palomar Health is reimagining the entire healthcare experience, including emergency care, is Acute Trauma Surgeon Dr. Gregory Campbell. Welcome.
Thank you.
Now, Palomar Medical Center's trauma team is saving lives every day. As a trauma surgeon, can you describe what your day-to-day looks like?
Well, it's a 24-hour shift. It's in the trauma room, which is just adjacent to the ER, and we see people who are gravely injured. Gunshot wounds, stabbings, motor vehicle accident, motorcycle accidents, or falls from tremendous height. And in the field, they're assessed by the paramedics, and if they feel that they meet certain criteria, they go to Palomar or any other trauma center because their injuries are life-threatening, where minutes matter.
Now, as a level 2 trauma center, Palomar Health is a leader in emergency care. Talk to us about your dedicated trauma team, new advances in surgical techniques, and cutting-edge equipment that's helping to improve care and recovery for life-threatening injuries.
Well, in addition to having the CT scanners that we need, the resuscitation models we use are on cutting edge, and then the team, each individual themselves is dedicated to trauma, whether it's myself, the ER doctor, the nurses, the respiratory therapists, the pharmacists. Everybody there is there to make sure that the most injured patients get the best quality care and the best outcomes.
Now, what would you say are the most important attributes for a trauma surgeon to have in terms of patient care?
In my field, I think it's confidence and compassion. You have to have the confidence to take care of these injuries which are life-threatening and stay focused and be unemotional, because you've got to save that life. Now, once the patient's out of trouble, then you have to interact with the family and show your compassion and make sure they know that their spouse or their loved one got good care, but now they're being cared about.
Dr. Campbell, you've been practicing for more than 30 years. What has been the most rewarding part of your experience?
Well, there is no one injury or pattern that's more important to me. My wife's an obstetrician. She brings life into the world. My team and I, we grab it by the collar and make sure it doesn't leave. So anytime someone can go back to their life, back to their family, back to what they enjoy, that's a good day.
Now, what advice would you give to young folks out there who may be interested in pursuing a career in medicine?
Well, first, I'd want them to know that you don't just have to be a trauma surgeon. There is all kinds of jobs in the medical field, which is still a wonderful career. There's anything from ER doctors to medical doctors, PAs, nurses, speech therapy, physical therapy. And I know at Palomar, we have a Pathmaker internship program where high school kids can enroll and they start to shadow the doctors, the nurses, and get exposed to all the different facets of medicine, including watching operations. So I would encourage anybody who's interested in the medical field to go to the Palomar Medical website and check on the Pathmaker internship program.
We'll find out how Palomar Health is reimagining healthcare. Learn more at palomarhealth.org. Doctor, we thank you so much for sharing some insight into your world.
Thanks for having me.
And we thank you for joining us on San Diego Living. We'll see you next time.